Well, good afternoon to you. I want to thank you so very much for allowing me to share this information with you. My name is Dr. Robert Bartosh, a Proactive Wellness and Injury Center, and I want to talk to you today all about acne. All about acne. It's a condition that affects young and old, male and female, regardless of what race, creed, or color you are. You can be affected by acne. And look, I want to say this before we get into it. I'm going to try to share with you as much information as I possibly can in this short time that you and I are going to be together. However, in the event that you have questions about issues that I haven't covered or whatever it might be, I invite you always, you contact our office either by email or phone or whatever, and let us know what those are. And I promise you that as soon as we possibly can, we will address those questions and get back to you with those answers that you deserve, okay? But I'm very, very excited about this. In our office, of course, my mantra, my goal is to help anybody and everybody that allows us, that walks in through that door, help them to achieve the best performance of their life, regardless of the name condition that they might come in with. Well, with that, I know that if you know someone or you are someone who is experiencing the throes here of acne and has been everywhere and has had no improvement or whatever, look, there is hope. We can help you. I say that unequivocally. We can certainly help you, okay? So with that being said, I'm going to go ahead and we're going to get into the video presentation here as I promised, all right? So all about acne, we're off and running, okay? So what is acne? Now you'll have to permit me this opportunity because this is going to get a little more clinical in the beginning. It's kind of, I just want to let you know what it is. So acne is a disorder. Of course, you know that, but it does affect the skin and the oil glands and also the hair follicles as well. It all starts in the pores, and those connect to the oil glands beneath the skin surface through a canal that's called a follicle as well. And within that follicle, within that cell, there's a thin hair that will grow. And those oil glands that are there are going to, or they can secrete an oily substance, and that substance is called sebum. And that helps actually to lubricate and carry the dead skin away out of the cells to the surface of the skin so that you and I, when we wash our face, that's what we're doing. We're getting rid of those dead skin cells. However, sometimes that hair follicle that grows in there combined with the sebum, the oil that's there, and the dead skin cells, sometimes they clump together on their way through that follicle, and they plug that area. They create that plug over that skin, and then what happens is the bacteria in that plug causes swelling, and that leads to what is called a pimple. All right. Now, who gets acne? Well, I covered that a few moments ago, but acne is the most commonly associated, it's most commonly associated with teenagers. And an estimated 80% of people between the ages of 11 and 30, they can experience and do experience acne breakouts at some point in their life. However, adult acne, and that occurs after the age of 25, is very much a real thing and can affect people well into their 30s, 40s, and even into their 50s, believe it or not. See? So it does not discriminate. It affects anybody, everybody, anytime, and most of the time. And it really does affect us quite severely in some situations. Now, acne through the life stages. Teen acne is partially genetic, and that's not a bad thing because in this particular office, I have been trained, believe it or not, to actually identify the gene that might promote the production of acne in the individual, and we can stop it, we can lock it, we can arrest it. And it's partially hormonal, and it's greatly linked to puberty as well. That's when you see a really outsurge or a burst of it. Adult acne is linked to hormonal fluctuations as well as chronic stress and some environmental factors. And when it comes to choosing any products for treating acne, you got to be sure to look up the age appropriate ingredients, because some of the products are made to deal with the teenage acne earlier on in a person's life. And some maybe in the midlife, maybe 25 to 30, and some are developed to work with the acne that might surface well into the 50 and 60-year-old age group. And adult skin can lose its ability to retain the moisture with age, so there's less of a cell turnover as well. So you've got to look at those products very, very closely. Now, and I know I'm getting ahead of myself, but even though the manifestation, the presentation, the evidence of acne is on the outside of the body, i.e. on the skin, the cause, because for every effect there's got to be a cause, the cause is deep inside the body, and we can help you with that. I promise we can do that. So anyway, before I get into some of those things, let's talk about what are the different types of acne, because there are different types of acne, and most people don't realize that there are different types. And I just want to share with you the most common types right now. There's the whiteheads, and those are the pimples that stay under the surface of the skin, and they're aptly described as a whitehead. Then there's the blackheads, the pimples that rise to the skin surface, and they look black. And the black is not dirt, actually. It's not dirt. And then there's the papules, what are called papules. Those are small pink bumps that they can be very, very tender to touch. Boy, when you touch them, they do have a soreness that's associated. And then there's the pustules. Those are pimples that are red at the bottom, and then they have pus at the top. And I tried to get a picture here of this young lady to demonstrate all those different types. You can see the blackhead here. You can see the pustules. Some of the others there, the papules, and then there's the nodules. Those are the really large, painful, those are the solid pimples, and they're deep in the skin. Those things, they can really cause some grief and some discomfort. And then, of course, the mother lode, those are the cysts. Those are very deep and very painful, and they're pus-filled pimples, and those are the ones that if they're not addressed properly, they can cause scarring, and that's, boy, you want to avoid that as much as you possibly can, okay? But that briefly is just an overview of the different types of acne that are plaguing people out there. So I mentioned to you that there are factors outside and inside. So let's address some of those outside factors that can make acne worse, right? Because there's a lot of myths about what causes acne. But there's some truths, some proven things that can make your acne worse. And one thing, especially for females, if you sleep with your makeup on, that can actually make acne, if it's present, it can actually make it much, much worse, okay? Using dirty brushes, now that we're talking about makeup, some of these makeup applicators, the dirty brushes in particular, if you use a brush, you've got to make sure that brush is clean, because that may have bacteria or viruses or little parasites or some kind of toxin, heavy metal, whatever it might be, that you're continually using over and over again, and it can plant the seed, if you will, on the face, especially if you do have acne present already. If it gets ingrained into one of those areas, it can make that much, much worse. Pollution, because these particles in the air, the fumes outside, especially if you live in a humid climate, the moisture in the air tends to gather all of the debris that's in the air as well. And when you're outside a lot and you're perspiring, or even if you're not perspiring, it has a tendency to attach itself to your face. And if we are not, washing our face maybe a couple times a day or whatever, that can make the acne that you already have present much, much worse. Now, look, this is something else I want to talk about, the hard scrubbing of the face. I know you want to get rid of it as quickly as possible. I know that for some it's quite embarrassing, or God forbid you get one that's 3 days before your prom or before your wedding pictures or whatever, and you think that vigorous scrubbing is going to make it better. Well, it doesn't. It breaks down the skin and it makes it more vulnerable, and it actually exacerbates or worsens the situation that you may currently have. And the infection that you have on the face, or the acne that's present, will probably 9 times out of 10 get much worse. So you want to abstain from the hard scrubbing of the skin. Also, and something that people don't think about, is the bacteria that may be on your phone. And we're constantly putting it up to our face and setting it down on a surface and picking it up and putting it by our face and whatnot over and over again. And where people are texting and their fingers are dirty, that gets on the screens. All of those types of things, the phones, your hands, you want to clean your phone, at least once a day, at the end of the day or the beginning of the day. However, you want to do that. And sometimes we share our phones. We fail to wash our hands. And I'm not advocating these astringents, these bacterial pumps that you see. I don't advocate that. Just using some warm water with some gentle soap every once in a while. That's all you need to do. All right. And when the weather gets better, some of us, we ride motorcycles or the motorbikes or whatever. If you're wearing helmets, you want to make sure that you wipe out the inside of the helmet. And with that also, if you have, if you're a teenager or an individual that's playing a sport that, utilizes a helmet, football, hockey, whatever it might be, not rugby, but lacrosse and some other sports, you want to wipe those helmets out from time to time. Make sure they're clean, because, you're going to be perspiring when you're engaged in the sport, and that's going to deposit some stuff on the inside of the helmet that you want to clear out and make sure that that's clean. Anything else, that you might touch areas of your skin that are acne prone. And also, taking certain medications or using certain skin products that cause irritation or allergic responses. You've got to, most people, when they take these prescribed medicaments, these medications, they don't really read the labels or the little pamphlets that come with them. And you'd be surprised and maybe even shocked to find out how many of these medications people are taking that actually break down that barrier in the skin and make it more prone to expressions of those different types of acne. So you want to check that out too. And then I mentioned also a few moments ago, the sweat buildup when you're out doing gardening or planting your flowers, or you're engaged in some kind of a sporting event or whatever. You just want to make sure that you at least get cold water, cool water. If you can't shower or bathe, you just want to, flush your face. You don't necessarily need to add soap every time. All you've got to do is rinse the face really, really good after those types of things, and it's going to serve you well. All right. So those are some of the, not entirely, but some of the outside factors that can make the acne worse. So with that, let's look to some of the internal factors that make your acne worse. And yep, you look and it's glaring, isn't it? The fast foods, I mean, they just boom, jump out at you, because unfortunately, a lot of those foods really do add fuel to the fire. And when they do that, they actually change the hormonal levels, especially, women during their menstrual cycles. If they already have some previous acne present, many times individuals going through their menstrual cycles or even their periods, it can cause the flare-up of the acne and make it much, much more profound. And then stress, stress will make it worse. Food sensitivities, they can make it worse. And the food choices you have. And some of these that I point out, the fast foods, the carbohydrates, the foods that are laden with sugars and hydrogenated oils, trans fats, those are all going to tend to make it worse. And the fried food, you see the the French fries or the fried meats or the fried, onion rings or whatever it might be. Those types of foods will definitely exacerbate it, as will um, the diet drinks. Oh, those are notorious for making acne worse. And here, they're sold as, helping you lose weight and blah 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 and all that other junk that they sell you, and which is not true. And also what they fail to do is to let you know that those sweeteners, those actually add fuel to the fire as well. They will make the acne worse. Those are just some of the internal factors. All the stuff that you put in you, they will definitely cause the acne to flare up. Okay? Because I want to equip you with information that you can use. Because again, as I tell all of my patients, sooner or later, that it's your body, it's your health, and it's your responsibility. And I'm here to equip you with information that you can use to achieve, as I said earlier, the best performance of your life, right? Okay, so we move on now to our skin because it reflects what's happening in our body. And I said not on the outside, but in our body, because what's going on in our body shows up outside our body. And that's something that many people forget, is this: your skin happens to be the largest organ of the body, and our skin reflects what's going on below the surface. See, that is a truth. So with that, what we want to do then is to dig a little deeper. We want to go beneath the skin and find out what's going on. Okay, so your microbiome, those are the bacteria that live inside your guts. They affect your overall health. You've heard about the probiotics. I mean, they're selling this and selling that, and people are taking the probiotics and that. And I've got to tell you, frankly, most of that stuff is garbage. It's ineffectual. It's not doing anything except causing the individual to spend some hard-earned money on achieving a goal that will never be achieved, because the stuff is just, and I know it's a sweeping generalization, but I'm comfortable in saying it because it's the truth. But getting back to you and me and what's going on, let's talk about the microbiomes there, because they are a collection of the bacteria and also the fungus in your gut. And probably the most nefarious or the most well-known fungus in your gut is yeast. And the research is showing us that the health of the gut, how healthy your intestines are, it's really going to impact almost every area of your overall health. I know I talk a lot about it in relationship to the brain. That's the most important area. But apart from the brain and the kidneys and the liver and the lungs and the stomach and all of the other organs, it also affects the skin, the quality of the skin. See, we've got a lot of bacteria in our gut and our body overall. And the research is showing us that almost over 2, even up to 4 pounds of our body weight is made up of those bacteria in the guts. Isn't that amazing? I mean, that is just, it's phenomenal. Who would have thought, right? 4 pounds of your weight. So if you're a 100-pound individual, actually 4 pounds of that is due to the bacteria made up in your gut. It is amazing the more we're learning about this. Anyway, that includes, both the good and the bad bacteria, the strains that are in your intestinal tract, in your digestive tract. And when that bad bacteria, however, this is what happens. See, you got the good and the bad. When the bad bacteria overwhelms the good bacteria, then you have the good, the bad, and it produces the ugly, right? So what happens is that bad bacteria outnumbers the good bacteria, and basically your gut gets sick. It gets inflamed, and it gets, of course, imbalanced or unbalanced maybe. And it creates stress in the body that you're not seeing, but that stress is deep inside the intestine, in the body, and that leads to issues in, as they say, everybody has an issue. It leads to issues in your overall health. Okay, so now that we know that, well, let's continue the dig and talk about something else. about the gut-skin connection, now that you and I are aware of that. Because in simple forms, or in simple terms, I should say, the gut inflammation that's going on now because of the overwhelming number of bad bacteria in the gut instead of good bacteria, that can eventually become systemic inflammation. And I'm telling you, it will cause, when I'm talking about systemic inflammation, I'm not talking about a swollen joint. I'm talking about the cells that make up your body becoming inflamed. This is a very serious issue that many people, unfortunately, are not aware of. But it does cause, eventually it causes systemic inflammation, and that can show up on your skin. So what I'm saying is this: if you have acne, if you have these dermatological effects showing up on your skin, then you do have cellular inflammation throughout the body. It's like the tip of the iceberg, I guess. You know, you got the tip of the iceberg, you only see 1/10, and you know the 9/10 of it are beneath the surface. Well, people are thinking, I only have this acne problem on the outside of my body, and unbeknownst to that individual is the fact that he or she has some more very serious things going on inside their body that they're not even aware of. But anyway, those skin breakouts, they continue to occur unless there's going to be some resolution, some change in their lifestyle, definite changes in the nutrition, and repairs that have to be done in the gut, in the digestive tract. And that's how that gut-skin connection is made up. Okay, so now, you go to some doctors and they'll say, well, it's all hormonal, especially if you're a younger female and, you're transitioning out of puberty, and you're, maybe a younger teenager to an older teenager going up into the later teens, or even women in particular. This woman now comes in and she's 32 years old, and she's got this outbreak of acne or pimples or whatever on her back or on her chest or over her face, and she's just beside herself. I can't believe this is happening. And she's told that it's a hormonal issue here. And we do know that hormones do play a part, some role in the acne development. And they can occur when there's a miscommunication between the brain and the endocrine or the glandular system of the body. And that can result in an issue like maybe adrenal fatigue, or what's known as androgen dominance. That's high testosterone. Yeah, you can start to have an imbalance there of the different hormones, where the testosterone in the female in particular rises up, and then you can have that pronounced acne that's developing. Or look, it may not be an overproduction of testosterone, but it could be an imbalance between the estrogen and the testosterone. You might have too low estrogen or too low progesterone, which makes it appear to be too much testosterone, when in fact the testosterone is normal, but that's the highest reading of the bunch. And you're erroneously prescribed some kind of a hormone balancer. See? So if you suspect that your hormones could be imbalanced, well, what you need to do is to talk to your doctor about it, and not play games with it. And again, it could be that the hormones are not the issue at all, but quickly you're given a hormone replacement therapy. I know that a lot of young ladies that have come to us have been prescribed birth control pills in order to address their acne problem. And professionally speaking, I've got to tell you that saddens me, because that really wreaks havoc in that person's body. And it starts, the first place to look. Well, anyway, I digress. But as I said earlier, if you have questions, you contact us, because I'm pretty certain we can help you out. So with that, instead of assessing the hormones, what you want to do is start with the food. Start with the food, because there are common culprits, for skin conditions, and one of which is a food sensitivity. Yeah, it's an allergic reaction that your body can be having, and that can be easily tested. And I'm not talking about, pricking your back with 500 little needles and that and seeing if you swell. That's not a very accurate way to assess food allergies or food sensitivities. So if you're interested in something like that, and I know I digress, but it's part of the program, then just contact us and I can give you information on that, on what I believe currently is the most specific, most accurate of all ways to assess any kind of food sensitivities or allergies. Because, look, food is our fuel, and the nutrients that we eat to help nourish our body can, if it's improper, it can harm us. See, it can harm our bodies. So what you have to do is to create a clean diet there, something that makes sure that you're getting the nutrition, because a lot of people are eating and eating and eating, but they're not really digesting their food. And if you're not digesting the food, then you're not getting the nourishment from the food. So I got to stop here and say, look, if you eat foods, and people say, well, when I eat this, I get bloated. When I eat that, I get indigestion, I get agita, I get problems, I get diarrhea, or I have constipation. Look, it's because your body isn't digesting the food that you are eating. It's as simple as that. And now the next question, can we help? I'm glad you asked. Yes, absolutely. We can find out if you're digesting the food, and if you're not, we can certainly help you with that, because those foods are going to promote, they're going to promote the quality of the skin on the outside, see? And also, look, if you're not digesting the food, and I know this is a little additional caveat, if you're not digesting your food, especially proteins, and I want you to hear this, if you're not digesting the proteins, those proteins that are undigested can get into your blood. When they get into your blood, those are food proteins that get into your blood. When they get into your blood, then the body will start to attack those proteins. And if that's not resolved, if that's not corrected, if that's not terminated, you will develop what's called an autoimmune disease. You will. That's the cascade of events. So look, if that's something, if you've already been diagnosed with autoimmune disease or disorder, if you're not digesting proteins, whatever, look, please call us. I'm here to help you out so that you can enjoy the best performance of your life, okay? All right, so now that we're talking about the food, let's also talk about cutting out the dairy. Let's talk about cutting out the dairy. Even if you spent your life eating dairy and you don't think that it causes any major issues, you still might want to cut back on the use of it, all right? Because dairy, all dairy, is very highly inflammatory, and it's a common trigger, very common trigger for many, many people for a lot of different problems. One of which that we're talking about in particular is acne. Plus, there's evidence that dairy consumption aggravates the skin conditions due to the milk proteins. See, I was talking about those proteins if you're not digesting them. And also the growth hormones and the anabolic steroids that stimulate insulin-like growth factors that we call the IGFs, insulin-like growth factors. These factors offset hormonal balances. They promote inflammation. I'm talking about cellular inflammation throughout the entire body, and they can create excess oil production on and in the skin, okay? That's the dairy. So even if you don't think that you have a problem with dairy, you might consider cutting back on the dairy, not consuming so much of it. And if you currently have acne, you might notice a reduction in the production of the acne, all right, just by cutting that back. And also, may I add, drinking more water. That helps to clean the skin out too, okay? So we move on now. And, gluten, everybody, I think, under the sun has heard about gluten. And a lot of people believe they have gluten sensitivities, and those are more common than ever before. And gluten-related symptoms can be as subtle as feeling fatigued or achy, and experiencing brain fog to having the acne that's produced. Now, what many people don't realize is that gluten triggers increased levels of a protein that's called zonulin. There's two that have to do with the gut. One's called zonulin, one's called occludin. And the zonulin, what that does is that particular protein regulates the permeability. That means the access through the lining of the gut. So the stuff that's in the gut can actually, if the lining of the gut that results from the overproduction of the zonulin, if the lining of the gut gets weaker and weaker and weaker, what happens is this: those proteins that you just ate, if they're undigested, they can push through the lining of the gut and they can get into the blood. The yeast, the fungus in your gut, can push through the lining of the gut and get into your blood. The bacteria that's in your gut can push through the lining of the gut and get into your blood. The viruses that are in your gut can push through the lining of the gut and get into your blood. The parasites that are in your gut can push through the lining of the gut and get into your blood. It's all that breakdown. There is a condition known as intestinal permeability, otherwise or more commonly known as leaky gut syndrome, and a lot of people have that problem where this garbage, literal garbage from your gut is breaking through, leaking through, and getting into your blood, and now it's being carried all over the body, even into the brain, and it results in what we call the blood. There is what's called the blood-brain barrier. That's even damaged or decimated, and this garbage can get into your brain. You can have leaky brain syndrome as well. But I digress. Let me get back on task here because we want to talk about the acne. All right. But you want to, as I said, you want to become more scrutinizing when you're buying food, seeing if it does have gluten in it, and if it does, you want to get a gluten-free replacement. Okay, that's going to help you out. Also, you got to maximize your micronutrients. Whether through whole food in your diet or your supplements, you want to make sure that you're getting enough. And as I said earlier, if you have any kind of digestive problems, even maybe unbeknownst to you, whether it's GERD or gee whiz, leaky gut, or you're bloaty, or you feel tired after you eat, or you're hungry after you eat, or you get cranky if you don't eat, or if you get headaches and all these other things, I'm here to tell you, you are not digesting your food and the food that you're eating, and you're going to be putting on weight too because the body's going to need more nutrients and it's not getting it from the food you're eating, so you got to eat more to make up for the deficit. Anyway, if any of those things are happening, then you're not getting the nutrients from the food that you're eating. And you got to eat whole foods, real foods. Not the packaged garbage, not the fabricated, not the fake food, not the food replacements, it's junk. There is no such thing as junk food. It's either junk or it's food, and there's no in-betweens, okay? So what you've got to be getting are the probiotics. You got to get zinc and selenium and omega-3 fatty acids. You got to get the B vitamins and the C's, and you got to get the E's, and they got to be real, the real deal, not the pharmaceutical, not the man-made manufactured garbage. You got to get stuff from whole foods, okay? We can help you with that. Anyway, and if you're already taking a lot of high quality supplements and you're eating a diverse whole food based diet, hey, you may not see results if your body isn't absorbing those things. See, so that's another thing I want to point out. You can be spending all kind of money getting all kinds of great supplements, even if you're one of our patients, coming in, and if you're not being forthcoming with me or with your doctor, you're spending all this money on whole foods, you're eating organic, you're eating clean, you're taking these supplements and blah, 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 and it goes on and on. Oh gosh, you're doing all these things and you're still not seeing the results, then you may not be absorbing those nutrients correctly. So look, if you are one of my patients, the next time you come in through our door, you let me know about it and I can help you. And if you're not, contact us. We can help you too. Okay. So if you suspect that that's the case for you, you make sure you touch base with us either through the phone or through the email or through the open door, right? Thank you. I appreciate an opportunity to help you out. So you want to make sure, again, you're maximizing, you're getting the best bang for your buck, for your dollar. All right. Now, with all of the foods, look, you knew it was coming. Yeah, you got to dial back on your sugar consumption. And you know, I put this picture of this donut out there with those little, sweet BB-like things on it. Those are great every once in a while. But the sugar consumption goes far beyond that. You really have to look at the foods that you're eating. And I want you to look at the ingredients on the label. You will be amazed to see how much sugar, or how many things I should say, that you might be consuming right now that have sugar in them. The condiments that you eat, the packaged foods that you eat, the boxed foods, the canned foods, the bagged foods, all of those things, the drinks that you're drinking, all of the sugar that's in there, because it's coming to you fast and furiously, I promise you. So the sugar, especially the refined sugar, that causes that inflammation, that cellular inflammation. And your body's only going to be as healthy as the cells that make it up. So I told you the largest organ of the body is the skin, and it's going to show up on the skin. And the studies that I've seen, they show that sugars, as we eat it, they actually age our cells. Yeah, they make the cells older. You can be 30 years old, and if you have a sugar-laden diet, your cells could be 60 years old on the inside. That's a fact. That's a fact. And it wreaks havoc on the gut. It just decimates your intestinal tract, your digestive system. And it contributes to a condition known as dysbiosis, where the machinery of the bowels, if you will, is just not running right. I mean, there's havoc going on down there. There's indigestion, galore that's happening. And also it allows for a yeast overgrowth, that fungus. So who are we talking about primarily? Yep, I'm going to pick on the weaker sex, the ladies indeed. And you run to the doctor, or you get this stuff over the counter, and it's supposed to clear up a yeast infection. Hey, it's coming from inside you, and that yeast that you're dealing with is outside of you. So by getting rid of that that's on the outside isn't going to get rid of the cause that's alive and well, I guess, for a lack of a better way to describe it, is continuing on the inside. You got to get rid of what's going on the inside. So the point here is that I want you to take note of how much sugar you regularly consume, and you got to cut back on it wherever you can and as often as you can. Okay, that's another thing that you have to do. And then also, when you've done that, you want to include gut nourishing foods. See, this I'm talking basically, and almost in the majority of the time, is the foods that you're eating. Once you remove or cut back on the inflammatory foods from your diet, like the gluten and the dairy and the sugar that we talked about, what you want to do is to start adding in foods that feed the good bacteria. Those are what we call probiotics, okay? You want to start with fermented foods. Very good. And you can make your faces and everything else, but sauerkraut is a really good one. Kefir is another good one. You can also include some probiotics like green bananas. These are prebiotics. I'm sorry, I said probiotics. These are prebiotics. These are the seeds that help those biotics, the probiotics grow. Jerusalem artichokes, dandelion greens, green bananas. Additionally, you can make a batch of bone broth then to add into your foods that would normally call for stock or water, and just drink the bone broth. You can add it to it or just drink it on its own. The collagen in the bone broth is considered to help mend and nourish the gut lining, and it will do so. And if you need some help with that, you heard me say it before, you're going to hear me say it again, and probably again after this. Just let us know. We're here to help you out. All right. And then also finding new ways to distress. I mean, who in this world isn't under stress? We're meeting ourselves coming and going. We're overwhelmed with information, with decision making, with peer pressures. I mean, a lot of stress. And then with this stuff going on right now, with this scenario that's being played out, everybody, everybody's under stress. So it does play a huge role in your gut health. And chronic stress, that stress that's with you every day, day in and day out, that can cause the acne flare-ups by increasing the inflammation, right, in the cells, and what's known as oxidative stress. That means that the cells are dying, or they're aging really, really quickly. They're rusting. I don't know, get that picture, because that's kind of what's happening to the cells. That's oxidative stress, and producing a stress hormone that's called cortisol. And those are signals that are sent throughout the body that keeps everything on high alert. I mean, it just never shuts off, and that's where you live. And simultaneously, the stress is going to deplete. It's going to suck out of your body the good stuff that you have, the zinc and the magnesium and the selenium. Those are some of the nutrients that help to keep the acne not only under control, but frankly, get rid of it. See? So you have to find ways to pull the plug on the stresses, or just tone it down. And you move on to the external issues, like when you're stressed, you're more likely to make poor dietary choices. You run to the fridge and you get something sweet and you eat, and then, you overeat, and then you hate yourself for having done it. And you promise yourself you're not going to do it again. And that's only going to make the acne and the other inflammatory symptoms much worse than what they are. So you got to do yourself a favor, and you got to try some new ways to ease away from the stress, or at least try to mitigate it some way. Meditation, yoga, time with friends, going for a walk, working out, getting a massage, or even better, a hydro massage. Yeah, we have that available. Let us know. You can set up a time where that's all you do. You don't come in for anything else other than getting the hydro massage. It's beautiful, and we can set that up for 30 minutes, 60 minutes, whatever you want. Those are some ways, though, to deal with the stress. And, aromatherapy, that's a nice thing, too. The lavender and the different fragrances, those are beneficial, too. But the point, again, here in this is to find a new way to de-stress. You can't get away from the stress. You just got to learn how to control it and, abate it somewhat. And then also, hey, you got to drink more water. Yeah, how much do you need? Well, you weigh yourself and you divide your weight by 2. So you're at 110 pounds, you divide it by 2, and you come up with 55, right? Okay, 55. That's how many ounces of water you want to drink in a day. So again, you get your weight, whatever it is, you divide it by 2, and whatever the answer is, that's how many ounces of water you need to drink in a day. And it's not, absolute, a little less, a little more, it's not going to hurt you, but be in the ballpark, all right? Because that's one of the best, and it's one of the most affordable things you can do for your gut and for your skin, and to help it stay hydrated. And when you stay hydrated, you won't have as many wrinkles produced. Yeah, that's a little added bonus, if you will. So as you go about your day, keep your BPA-free canteen or your thermos nearby, and you just continually fill it throughout the day. You empty it, fill it up again, empty it and fill it up again until you reach your quota. That's what you want to do. You just want to make sure that you're drinking filtered water or mineral spring water. Spring water is really, really good. Make sure if you can't get the spring water, then drink the filtered water, because there may be trace amounts of antibiotics or convulsants or mood stabilizers or hormones that are in your tap water. You don't want to be drinking somebody else's medicaments or prescribed medications. You just don't want to do that, because if you're drinking that dirty water that's polluted with that garbage, it will affect you over time, right? And then another thing here, now that we're on to that, don't go over the top with your skin care products, okay? Just don't do that. There are so many skin care products on the market, and not all of them are good for you, really. So what you want to do is to be most wary of are the products that are laden or have a lot of chemicals in them and harsh additives. See, you really do have to look at the labels. And luckily, deciphering the good from the bad is actually, when it comes to skincare products, it's actually easier than ever. Before you go out to the local drugstore, or your boutique, I think it's boutique. You want to do some research. Yeah, you want to be an informed merchant. So you want to do some research. You want to make sure that the products that you're putting on your face are going to be clean and they're going to be non-toxic. There's a group that you can go on the internet for this. I believe they're called the Environmental Working Group's Skin Deep Cosmetic Database, if I remember correctly. Oh, no, I'll tell you where you want to. What you want to do is just type in EWG, yeah, the Environmental Working Group.org. And then you can / that, and you can put in skin deep or skin care or something like that. And they'll give you a whole lot of information about the good and the bad, and the regarding skincare products, and the ones you want to stay away from and the ones that you might consider purchasing. That would be a helpful database to you. And look, also, with all of these things, I would be remiss if I didn't share with you. I said to you that some of these conditions, many of these acne or skin-related conditions have attending bacteria or viruses in that. In our center, we have lasers. I have different lasers for different uses and whatnot, but we have one in particular that is FDA, Food Drug Administration cleared. It's been validated. It's been proven to destroy acne, ACNE. It uses violet wavelengths. So look, if you're interested in something like that, you're welcome to contact us. We can give you more information on that so that we can help you, again, as I said, not only get rid of the acne by using the lasers, but also help you to achieve the best performance of your life, right? Okay, so if you do have questions now, I want to just remind you, you want to call us, you can email us, if you are one of our patients, you can let us know the next time you come into the office. Also, so I don't forget, we have the availability now to do virtual consults. So look, if you're not a patient of ours, or if you are and you're rather timid, you can set up a face-to-face on your computer with us. We can do a virtual consult, where we can do it, from your house to ours. There's no cost for that, and you don't have to download any specific software or anything. Just let us know, and we can set up what's called our Doxy, DOXY.com appointment. You can find that on our website. If you want to schedule an appointment, you just scroll down there underneath that, and it tells you how you can go ahead and set up that virtual appointment with us, regardless of where you are. California, Pennsylvania, Texas, wherever. You won't even have to come in Oakwood, Penfield. You can set up the appointment, not even have to come into the office, and we'll be more than happy to help you out with that, okay? But make certain that if you do have questions, you get in touch with us, because we're here to help you out, all right? And don't forget your skin. You don't want to fight it. You want to work with it. Don't fight your skin. You want to care for it. one of the main takeaways I want you to walk away with is that you do not need to be in a fight against your skin. And I want to remind you that for every effect, there is a cause. Your body wants to be well in every area of health, including the vibrant, healthy looking skin. Okay, it wants to give you vibrant, healthy skin and get rid of that acne. So you don't need to feel the shame. You don't have to be you don't allow aggression to rise up, or resentment because you got the short end of the stick or whatever, because you got acne and your siblings didn't, or whatever, or any other negative emotion that you might be generating against yourself and against your skin. You know, just like you'd treat a scrape on your knee, you need to care for your skin in the area of acne. You want to handle your body delicately, you want to respect it, and you want to remember that it wants to be well. And remember that for every cause, I mean, there is an effect, or I should have said for every effect, there is a cause, and we're here to help you. If you have this effect that you've allowed me to share this information regarding, if you have this effect, please know that there's something that's causing it. And all we need to do is to find out, identify what the cause is, and remove it. And your body will do the rest in helping you to resolve this situation, because the body does all the healing. Hey, look, I want to thank you for allowing me this opportunity to share this information with you. And as I said, if you or someone else that may have this challenge going on in their life, please share this information with them, and let them know that I'm offering them the same opportunity to discuss their problem with them as well. Okay? Thanks again for allowing me to do this. And until the next time, and as always, make sure that you let us know if you have any challenges. And as always, and until the next time, God bless.